Hi, I am Dr. Praveen Kumar M, consultant rheumatologist at the Daivik Arthritis and Rheumatology Center. I am going to tell you about the Sjogrens syndrome. Sjogrens syndrome is one of the common autoimmune disease in elderly females, even though younger female also can get affected. So it is named after a Swedish physician Henrik Sjogrens. The common symptoms. The patient affected with the Sjogrens syndrome comes with the dryness of the mouth, in that they have difficulty in chewing the dry or solid items like biscuits or a chapati, or a frequent dryness of the throat, especially if they talk for a long time, and also they may have frequent dental caries. So patient feels a pricking sensation or foreign body sensation in the eyes. So they may use the tear drops as prescribed by the ophthalmologist for a dryness of the eyes. So other symptoms include fatigue, fever, joint pain, or skin rashes, and few may also complain of pricking or needle sensation in the lower limbs, or a cough or a breathlessness if lungs get involved. What causes the Sjogrens syndrome? The exact cause is not known like all the autoimmune diseases, but it may be because of the interplay between the environmental factors and the susceptible genes, which lead to a formation of autoantibodies which will attack the body's own immune system. In Sjogrens syndrome, it is the target is usually the parotid glands or lacrimal glands, which helps in producing the saliva and the tears. So once they get attacked, so that will lead to a gradual dysfunction of these glands, leading to the dryness of the mouth and dryness of the eyes. How to identify Sjogrens syndrome? So the diagnosis is based upon what patient says, that is the symptoms, and what doctor says, that is the signs, with a routine blood test, which includes a complete blood test and kidney function test, liver function test, and anti-nuclear antibodies, which will detect the disease. Doubtful cases may require a lip biopsy to confirm the diagnosis. So coming to the management or a treatment, early diagnosis is a key in the management of the disease. So most of the patient requires a symptomatic treatment in the form of giving a salivary substitute for the patient who have a dry mouth. If the patient have dry eyes, then a tear drops will be prescribed. Low-dose steroids are a painkiller given if the patient has a joint pain. If the vital organs are affected, like lungs, kidney, then we will start them on immunomodulators. So the patient should come for a regular follow-up and the visit just to assess the disease activity and the side effect of the drug. As it is an autoimmune disease, the treatment will be of long-term duration. Certain health tips are given for the patients who suffer from Sjogrens is that patients should use the goggles, especially in dry and humid weathers. They can use a lozenges or a chewing gums if the patient has a dry mouth. Patients with a dry skin should use the moisturizing or a lotion, and also patients should do a regular exercises to maintain the ideal body weight. Patients with a joint pain should do a regular stretching exercises to maintain the functionality of the joint. So overall, Sjogrens syndrome is like any other autoimmune disease, requires a long-term medication. So regular follow-up and blood checkup are vital in the management of the patient. Thank you.